Hey, thanks, everyone. Good morning, everyone. Welcome to PowHer's special call, which is a briefing on 3 important budget issues. And we have some terrific experts to talk about 3 issues. I'm Bev Neufeld, president of PowHer New York. For those of you who are new, and there are a number of people who are new this morning, PowHer is a network of over 100 organizations. What makes us unique is that we come together across issue areas. And I think it's unique too that we find ways to collaborate, that's our goal, is to set a general or shared agenda and then help each other, move that forward. And that's exactly what we're doing today. For all the regulars, thanks for being on the call. We're going to have a little bit of a different leaders call today because we've invited in guests to hear this. And for anyone who's new, please be in touch. We'll be in touch with you after. We'll send you the deck, etc. But if you have any questions about PowHer, you can also direct them to me. The 3 issue areas that we are going to talk about today are childcare, home care, and reproductive health. They're all important issues to PowHer over many, many years. But today we're talking about them in the context of the budget. We'll hear from, let's see, just so you see everyone's name. Abby, you want to put that slide up? There you go. Yeah, so I'm Bev Neufeld, and these are the people who will be speaking to you. They'll introduce themselves to you as they come on. And I'm going to thank Catherine Bodie of the New York Civil Liberties Union to kind of get us started with just an overview of the budget process, because some of us are new to it, a timeline, sort of the high level points. I will be putting into the chat a link to the book, and that has everything in the budget. We don't, just it's for your information. I don't think anyone's able to read it, but I'll send it around for after too. So just so you have a context. All right, Catherine, you want to just give everyone sort of that top line view of the budget process?
Absolutely. Good morning, everyone. My name is Catherine Bodie, she, her. I'm the Assistant Policy Director at the NYCLU. And I'm just going to talk a bit about what the New York budget process is like. This is a process that is both dictated and constrained by the New York State Constitution as well as statute. And it's really a process that's happening all year round when thinking about advocates trying to position various asks, as well as policymakers thinking about the year ahead. But we are certainly in the thicket of it right now in Albany, with the executive budget coming out last week. And that executive budget is put out by the governor's office. It is kind of the opening shot, and it describes both policy and fiscal allocations for the next year's budget. After that, the governor has the chance to enter 30-day amendments. And so we will expect to see those later in February. Those are mostly just technical amendments, although advocates are really pushing hard off of this first budget proposal, meeting with the executive, meeting with the houses in order to align the budget with the ultimate budget with our advocacy goals. After the 30 House, we usually see the one House budgets, which is a budget from the 2 different houses, the Assembly and the 2 different chambers, the Assembly and the Senate. And from there, it's really a 3-way negotiation that happens in Albany, sometimes largely behind closed doors, but there are really points of influence that I'll talk about in just a moment. But the ultimate budget is due on April 1st, and sometimes the budget is late, but most of the time, policymakers and like to demonstrate to the public that they are efficiently running the government and our coffers. So the only thing that I want to mention that it might be a little different this year is that this is the first year in Governor Hochul's administration after her election, in which she is running the budget process. And it's a little different because I think that we've seen or experienced other governors, specifically Governor Cuomo, who ran a very tight budget process. And I think that it feels a little different this year. And so we should just expect that the targets of our advocacy will also shift, and just be open to what that looks like. And then the second thing I was just going to say is that there's also a political dynamic in Albany right now around the LaSalle issue, and the tensions that are really existing between the legislature and the executive. So yeah, that's the overview of the budget, and I'm going to pass it back to Beth.
Thank you. Thanks so much, Catherine. We're going to dig right into, our three issues. Our timeline is, the budget is by April 1st, right? It has to be passed by April 1st. So we have not that many weeks, to influence what happens there. So we'll hear about the three issues, but I hope that you'll also get things to do, and we'll link you to the advocates afterwards so that you can jump on their campaigns. So let's get started with Ilana Berger from Hand in Hand, Domestic Employers Network. You're the New York Director and Strategy Advisor, and also representing New York Carrying Majority. Ilana, get us started today.
Hi, everyone. And actually, I don't think I need the slides right away because there's a bunch of background I'm going to give that is more, I can just do it like that and then I'll do the slides. So yeah, my name's Ilana Berger. Here representing Hand in Hand, a sister organization to the National Domestic Workers Alliance, and the co-director of New York Carrying Majority, which is a coalition of organizations representing older adults, disabled New Yorkers, home care workers, and family caregivers. I also have COVID, so my brain is really foggy, and I apologize if I veer off into interesting spaces. So mostly, and actually just one piece that Catherine mentioned about budget and sort of Kathy Hochul. I don't know if folks saw that Politico article recently where somebody was likening, sort of really looking at the fact that she has not had particularly good strategic advisors, and that there was a comment about people often playing checkers, talking about someone playing checkers to chess, and that her team is playing tic-tac-toe, which may or may not be true, but I do think there's a lot of sort of questions about some of what's happening on her end. And from our perspective related to home care, her executive budget is a huge question mark. So I will get into that. Our team at New York Carrying Majority has partnered with many organizations to lead the Fair Pay for Home Care campaign. And the context is just New York aging incredibly rapidly. I can share fact sheets later with all the, alarming statistics, but we're aging very rapidly. People are living longer, and both based on just common sense as well as really interesting surveys done by both SEIU and the AARP, the vast majority of us prefer to live and age in our own homes and communities. Many of us will need support in order to do that, and home care is one of the things that allows New Yorkers to stay at home and not have to go into a nursing home or other institution. And this is for older adults as well as disabled New Yorkers of all ages who have jobs, who have very full lives, but require home care to literally get up, get out of bed, and get to work. So as the need for home care grows, we are coming up against the fact that New York has the worst in the nation home care worker shortage right now. we're going to be short at least 85,000 home care workers by 2025, according to the Mercer labor analysis. And this is largely because home care workers receive such low pay. Over the course of so home care has been at minimum wage, which for a good chunk of the time we've been running this campaign, home care was paid at less in the 54 counties north and west of Westchester County, less than fast food. So our team, which includes the New York Caring Majority, as well as SEIU 1199, the AARP, NAACP, and a number of other organizations across the state, launched the Fair Pay for Home Care campaign a few years back. And over the course, I'm trying to think of the best, over actually, let me just, I think now we could do the slides. So Fair Pay for Home Care has been a campaign for the past few years. And it essentially would do two things. It's been sponsored by Rachel May in the Senate. And then Amy Pollan, who's taken over for Dick Gottfried as Assembly Health Chair. She's our new sponsor. So we had to reintroduce it this year. So we do have a bill number in the Senate, but not yet in the Assembly. I can get you that bill number in a second. So essentially what it does is acknowledge home care as high skill, life-saving, essential work where home care workers, do wound care, medical needs, they do toileting, heavy lifting. They're often people's only companion. It's not a minimum wage job. We want it to be paid as the high skilled medical work that it is. So the language, thanks, Bobby. Bobby Sackman, who's here, is a decades-long advocate on these types of issues and is an essential part of the campaign. So it would index home care to minimum wage, requiring it be 150% of minimum wage. This just would, it doesn't have an assembly bill yet. They're still getting it through the draft Senate. So yeah, it's saying where it's not a minimum wage job. This is what is required to stem the shortage, is that we need to be able to have people making more money. The workforce is just hemorrhaging workers because the pay is so low and the work is so hard. And the final piece, which we'll talk a little bit more, it had a more sort of wonky piece because of the way, 87% of home care in New York is Medicaid funded. And I think you can go to the next slide now. The way that Medicaid funded home care works, Governor Cuomo privatized the Medicaid home care delivery system about 12 years ago. The Medicaid dollars come in through the state, and then rather than going directly down to home care providers who then pay the workers, it goes to these insurance companies who then set the rates and are able to decide how much to pay home care providers, which is either home care agencies or other entities in the consumer directed program. That's way too confusing to go into. And then those providers pay the home care workers. In our legislation, we set a base rate because for many of the home care providers, these insurance companies at the first level are holding on to money and not paying enough down to the home care agencies, so that the agencies are not able to cover the cost of increased worker wages. And so they're covering it through their own bottom line, basically they're having to take out lines of credit. Meanwhile, hundreds of millions of dollars of taxpayer dollars designed for care are exiting the system and getting in the pockets of insurance companies. So you can go to the next slide. So that's what Fair Pay did. In our budget fight, over the last 2 years, and especially in the budget last year, again, we built a massive coalition. We had bipartisan supermajority support in both chambers of the legislature and bipartisan support, like pretty strong Republican support as well as Democratic support. Care is something that impacts all of us, and it crosses urban, rural, suburban, Democrat, Republican, faith, all the lines. Everyone has care needs. And so it was a really popular issue. I do just want to add quickly that the other piece of this campaign is CUNY did a report for us that showed an investment in home care, unlike so many of the investments that the state puts into economic development, sometimes $4 million subsidy per job created to some big corporation. if you invested in home care, it's a 2-for-1 return on investment. This is folks getting off of public assistance. 57% of home care workers in New York State, who are 90% women, 80% people of color, 57% are on public assistance of some sort. So you get people off of public assistance, saving the state money, and you'd have billions of dollars of spending in local economies that would generate over 200,000 home care jobs, as well as other jobs in other sectors. So it was all like, we had so much support. We felt like it was a gift wrapped thing to give to the governor, like really no opposition, vast support across the state. It's an issue that polls really well. And both the Senate and the Assembly put the full language of fair pay for home care in their one house budgets. What we ultimately won in the budget last year. I'll get, after this presentation, I'll send a link to all this information. We won a $3 hour raise for home care workers statewide, and it was indexed to minimum wage, which was, it was nowhere close to the full fair pay for home care, but it did, at least the governor nodded to the fact that home care is a high skilled medical job and not minimum wage. So we'd always be $3 above minimum wage. The one thing that did not happen is the language about how the payment happened. So what ended up happening, and so it was a $3 raise. The first $2 went into effect October 2022. And the final dollar will happen this coming October. So all of this new money for raises went to these insurance companies, who then, when they bargained in very bad faith with providers, did not give them enough to pay for the wage. So you can do the next slide. So what happened in last October, this is just really quick, just to show like what LICSA as a home care agency, what their costs are. It just shows that almost everything, if you have a $2 raise, you have increased expenses in worker wages and benefits. And then there's other small pieces of what their costs are. You can go to the next slide. I'm going to go through this next part just really quickly. Essentially what happened, though, is that providers were not given enough to pay the workers what they needed. And so they were taking out lines of credit on their own to pay for, because the worker wage was mandated. You can keep flipping through these. I think it's causing serious impact. And then I think you can so go back one. So coming into the budget, we were in the position of just arguing. Again, we have this big coalition. We were coming in with a general expectation that Governor Hochul, given that she recognized home care is not a minimum wage job, that she recognized that workers do need a raise, and that they blatantly failed on fixing this payment mechanism and like stemming the siphoning of our taxpayer dollars that are supposed to be for care into insurance companies' pockets. And we got a lot of attention. We had a lot of media attention to this issue right before the election. Melissa Russo on Channel 4 like directly asked Kathy Hochul. Oh gosh. Okay. So anyway, we were expecting her to not do much, but not the terrible thing that she did. So go to this in the executive budget. What she actually did was, it only took her, 6 months to undo the promises that she made in her last budget. So because of the proposal to index minimum wage to inflation, which I just want to also share that is wholly inadequate, even though in her like rhetoric, she says it's such a great thing. The actual language in the budget about the minimum wage, it's like tiny increases. There's all kinds of caps and off ramps that really limit how much she's actually doing. Many people have said her budget is really a war on workers overall because it's such a tiny raise. But what she does in her budget is eliminate this whole thing that home care is not a minimum wage job. So this is just a little diagram we made. In her budget, in the minimum wage section, she says home care worker wages freeze at $18 an hour, which they will get to this October, actually, when they go at least downstate. And then they'll freeze at 18 until the minimum wage reaches $18. And then all the wages, if they go up, can go up together. So home care will be back at a minimum wage job. So you can see this, the yellow line would be if home care remained at $3 above minimum wage, but you can see where, because she's capping it at 18, where it goes flat. And then the next slide is just what it would look like, what fair pay for home care would do for home care in addition to that. So you can end the slides now. So we're coming into this budget. Oh, the one other piece, I have one more minute and then I'll be done, Bev. She also,
because we have to go on.
Yeah, I'll be right. She carved out an entire the consumer directed workforce in the city. She carved them out of this wage parity proposal, which is like up to a $4 cut for about 150,000 home care workers. So we're coming into this budget just much more on the defensive than we thought we would, we are continuing to get sign-ons in the Senate, the Assembly. We're really working hard to get budget letters. So we're still fighting for fair pay, trying to get in the one house budgets again. There's a lot of ways to plug in, particularly around, we have a district leader team. So folks meeting with their own elected reps, and we can connect people into that, as well as memos of support. Yeah, we're going to continue to fight on this, and we really hope that we can convince folks that the governor is just absolutely wrong-headed on this, as I'm sure we will hear on many other issues.
Alana, thank you so much. We'll send around the deck, but also, a list of ways that people can plug in. So everyone, you don't have to write that down. You'll have it after, probably tomorrow. So Blue Carragher, Blue?
I'm here.
Yeah, there you are. So Blue is speaking for the Empire State Campaign for Childcare. And you're piggybacking on this because these two issues in our minds are so related to women's economic, security and capacity to do their work and to succeed, to take care of their families, et cetera. So what about childcare on the other hand, on the kind of the other side?
Bev, just clarify for me right now how much time I have.
You have, let's do 10 minutes.
Okay.
Okay.
Great.
Thank you.
And Bev is right. These issues are directly related. They have very much to do with a long history of underpaying or not paying women for caregiving responsibilities, for not recognizing the changes that have gone on in our culture, in our economy, that now demand, and that in most families, both people in the family who are adults have to work in order to meet whatever their housing, which is constantly increasing, grocery constantly increasing, just to meet basic needs. In general, most people have to work. And yet we still treat the people who work in these fields, women of color, as if they're not doing professional jobs, of which they don't deserve professional pay. So that's a huge issue for childcare as well. Abby, you want to put up the first slide? All right. So the Empire State Campaign for Childcare was established in 2017, but advocacy around childcare has been going on for a long time before that. But we have a statewide coalition, parents, providers, educators, unions, employers, everybody fighting for two overarching goals. One, thriving compensation for all childcare providers, all right? Not just minimum, thriving compensation for the people who are raising the next generation, who are establishing all of the basic important foundational learning for children that will impact the rest of their lives. And we need to pay them and demonstrate respect and understanding of the professional work they're doing. The other aspect we're looking for is making sure that every single child and family who wants and needs childcare can have access to it and access to quality care. So those are our goals. We are working very closely with Senator Jabari Brisport, who's chair of the Senate Committee for Children and Families, and with Andrew Hevesy, chair in the Assembly of the similar committee. Senator Brisport last year introduced a universal child care bill that holds many of the things we're fighting for. And we continue to try to capitalize on the fact that our current governor was head of the child care task force established by Governor Cuomo after a huge level of advocacy from women in the legislature. And so we know that she has the background, she has the facts, she has the concepts that could take us to universal child care. And in her rhetoric, she often and has increasingly talked about, well, that's a goal that we should get to. But the question is, when will we get to it? How? And what's happening right now to deal with the crisis in childcare? So similar to the elder care and home care situation, the child care system is like a leaky bucket. So child care workers leaving on a steady pace. We have many, many child care centers who cannot keep their doors open or cannot expand to meet the need for child care because they can't attract the workforce. That, as you can imagine, as any of us who've dealt with children or grandchildren know, it's a high demand job. And we cannot, we're losing childcare workers constantly, and we're not filling up that bucket again because there is no attraction to come into a field, no matter how much you want to work in it and how much you love working with children and how much education you have pursued to get there. No incentive to come in when you're not being paid adequate wages. All right. So our demands for this year, first of all, invest in the early childhood workforce. That means for the short term, we need $1 billion in the budget this year, an increase of $1 billion to establish an emergency workforce fund. This would provide an immediate bonus of $12,500 for every childcare educator this year. We believe this is essential to keeping the doors of our childcare providers, whether they're centers or home-based, open. In the long term, we are asking for legislation that mandates a transition to a methodology in the state that actually determines what the true cost of care is and reimburses providers based on that true cost of care. The market rate survey that is used now to reimburse providers who take and have slots for children who have a subsidy support is totally inadequate and does not reflect the actual cost of care. So in the workforce development, that's what we need. The governor has proposed, and I have to find it right here right now, but she's proposed some money for the workforce, but it is not nearly enough. So she's proposed $389 million. It's just not going to do the trick. Okay. The other thing that we had in our workforce proposal is $190 million for insurance premium support for those providers who have no coverage. The executive budget contains nothing in this area. And there's the governor has acknowledged that we need to continue the work of evaluating workplace compensation models. And she has said that she is going to start up again the Child Care Availability Task Force. But that was said some time ago, and there's no meeting established, and it's not clear who's on the task force yet. So we have some nod that she understands what the issues are, but not nearly the investment that we need. Okay, is that next slide? Okay. The next issue that is most important is helping more New Yorkers actually access childcare. So we want to make sure that childcare assistance is available to all without regard to immigration. There are about 28, I'm going to find it here one second, thousand children who need access, who are really income eligible, and are here legally, but for problems with language and legislation, they are left out of the program. And so we want to see that extended to them. We want to see that we don't help families on one end by giving them a higher subsidy to pay for childcare, and then on the other end, because they're have a little bit more income, they lose all their other benefits. It's called the benefit cliff, and what benefits you have for SNAP or other kinds of things to help support you, you can lose all of them if you reach an income threshold. So if we're going to increase access and increase subsidies, we got to make sure that we're covering the other end of it. The executive budget does propose to reduce co-pays for families to 1% of income over the federal poverty level across the state. And so we are very supportive of this proposal. So that we do have some support and are working with the governor around a couple of these areas. We also want to make sure that anybody who is already qualified for eligibility for public assistance just automatically gets covered and doesn't have to go through another huge process to qualify for a child care subsidy. The last area is breaking down barriers to care. Again, we were glad to hear the governor address this in her State of the State and include language around this in the budget. It's a huge mess when it comes to reviewing and approving applications for parents to get access to subsidies for childcare. It's an equal mess to get providers to be licensed, to renew their license, or to address some identified problems that oversight might have identified in their agency. So we need to break down these barriers, and the governor has made a commitment to work with OCFS, the Office for Children and Family Services, to do that. Let's see, anything else? We want to see automatic rate increases for providers. So we did pass in the past some automatic increases, but many providers then have to go through another application process in order to benefit from what was passed with intent by the legislature. And we want to make sure that providers get reimbursed based on enrollment, not attendance. Any of you who've run any kind of similar business know that running on attendance is untenable. So those are our major areas that we're working on this year. As you can see, we have some recognition and support from the governor, but we need a much bigger investment. There was a slide, I think, about an action you can take.
Yep.
Okay.
It's great.
All right.
Yeah.
So our big push, as I said, is on compensation for the workforce. So there is a Empire State Campaign Toolkit. You can call on your state legislators to support the investment that we need to ensure affordable access to quality childcare. And let's see, you're not going to be able to work from that. So you need something in the chat, right? Are we going to send it afterwards?
We will, but you could still put it in the chat when you get off Blue, because, you know, folks are on now. So, but we'll follow up with it.
Okay, great.
Great. Blue, thank you so much for all of that. Obviously,
Sure.
back to back. Thank you. Yeah. Obviously, back to back, that's a lot of information. And they're connected for PowHer in our conversation about the value of women's work. The way women's work has been devalued, and because women are siloed into these jobs, it's historic. But we have to make sure that women can, you know, have one job and care for their families, and not have to go through what they are going through now, whether it's looking for childcare or looking for home care, or actually being in that profession. Which is, I think in both cases, you're pointing out that it's not appealing when there's not enough money. They're hard jobs, as we know. So, so that's on the sort of value of women's work that PowHer talks about and is digging into. And maybe now, as we move to reproductive rights, it's perhaps the value of our bodies, our health, you know. But the reproductive rights issue is very important to PowHer. It's part of our autonomy and our ability to take care of ourselves, our families. So let's look at, there are two reproductive rights efforts. And I'm first going to call on Quadira Coles from Girls for Gender Equity to talk about one, and then we'll switch to Georgiana Hansen from Planned Parenthood Empire State Acts. So Quadira, are you there?
I am here. Good morning, y'all. Sorry I did not prepare any slide. I'm trying to turn my camera on. I didn't prepare a slide deck. I am in the middle of moving, so things are getting a little chaotic here. But I can definitely go over one of GGE and just overall majority of the gender equity organization's priority for this year, which is the Reproductive Freedom and Equity Act. As we saw after the leak of the Dobbs case and then the final decision on the Dobbs case, Governor Hochul invested a substantial amount of money to providers and clinics in New York State to expand abortion access. But what we know now is that that money was only temporary. So the governor is trying to figure out how to sustain that line of funding, because we know that the demand of abortion needs has increased largely after the Dobbs leak, especially from folks coming from other states up to New York. Outside of GGE, I'm also the president of New Jersey Abortion Access Fund, and I do work closely with folks, abortion funds in PA and in New York, which is, you guys know, as NYS. So we are very aware of the high demand and high traffic of folks coming from all over the country into safety net states and expansive states and green light states like New York to get their abortion care. So the Reproductive Freedom and Equity Act is sponsored by Senator Claire and Assemblywoman Gonzalez Rojas, and the legislation establishes a program to ensure better access to abortion care in the state. The program will provide funding to abortion providers and nonprofit organizations, which is an expansion of the original funding that Governor Hochul allocated, whose primary function is facilitate access to abortion care. The program is designed to provide support to abortion providers to increase access to care, fund uncompensated care, and address the support needs of the most marginalized individuals trying to access care. So these are folks like undocumented folks, young folks, LGBTQ folks who wouldn't go to your typical provider or clinic and would prefer to go to a clinic that's more culturally competent and that can best meet their needs. So that's essentially the safety net and the gap that this bill will close out. I was going to make another note, but it is leaving my brain right now. Yeah, that's essentially what the bill is. So the bill did pass through the Committee of Health on the Senate side. And as we all know, there's some backlog on the Assembly side. So there's hopes that the bill would pass in the same ways that it passed through the Senate. And then we can bolster up support on the governor's side to sign the bill, because what the legislation would do is codify the program so that every year we're not trying to figure out how we're going to fund abortion access. And another one of our demands is that the governor actually adds this fund to her executive budget. So some action items folks can take: if you can create a memo of support for the bill, naming a recommendation that the governor add this fund to her executive budget, but also support and sign the bill once it passes through the legislature. And best time to send these letters of support for the budget, I believe, is February 17th. And I can provide more details via email where I can lay everything out and give a copy of GGE's memo of support if anyone needs a reference.
Thanks so much, Gadira. There is a question. Does anyone have any stats as to how much of an influx New York is seeing from other states? I don't know if anyone has that, but we're going to turn to Georgiana as well. So, okay, we'll have that on the table there. Georgiana, you want to join us? Georgiana Hansen? Let's see. Do I see you there? I'm sorry. Oh, there you go.
Good morning.
Good morning, Georgiana. Thank you for talking about some other priorities that are budget related. I'm sure we all have other legislative priorities, but right now we're in budget season. So appreciate your talking about that.
No, my pleasure. Thanks for having me. Again, Georgiana Hansen, she, her pronouns. I'm the interim president CEO of Planned Parenthood Empire State Acts. And I'm here to talk about one of our collective main budget priorities, which is increasing reimbursement through Medicaid for reproductive and sexual healthcare services. Here comes the slide. So as you may know, Medicaid is a critical program that ensures low-income individuals have access to high-quality care. It's a critical program, especially for those with the capacity to become pregnant. This is a stat that that Kaiser has in New York. 25% of women ages 19 to 64 have Medicaid coverage. For Planned Parenthood, it's over 50% of Planned Parenthood patients in New York rely on Medicaid coverage. So it is a critical way in which individuals access care. I think folks know too, reproductive and sexual healthcare providers are often an entry point into healthcare delivery system for folks. We're often their only source of care. Like other healthcare providers, but especially small safety net providers, have seen significant underfunding over the years, and that is really dramatically challenging providers' ability to expand access, to invest in their workforce, to invest in their facilities in a way that can meaningfully increase access to care in communities. And so we were seeing this, obviously, certainly in COVID, post-COVID, before COVID, these challenges of when you're a small safety net provider, especially how you remain competitive in a marketplace that is highly competitive. And when those are challenges that that's hard to face, that impacts access directly. And so one of the real big factors of increasing access in our mind is really boldly investing in resources, whether it's through grant funding, Dara just spoke about, but also actually in what these providers are reimbursed in the Medicaid program to really strengthen their ability to meet need. So today, providers are reimbursed significantly less than what it costs to deliver care. And as I said before, that directly impacts access. Other access states like California, Illinois, Oregon, they've all really taken steps to increase reimbursement for abortion. And New York, frankly, is falling behind in this space. For example, states like California and Illinois are reimbursing hundreds of dollars more than New York is right now, especially for medication abortion. Folks may know medication abortion is a critical aspect of abortion care delivery. Over 50% of abortions in this country prior to Dobbs certainly were medication abortion. And in New York, I would say 60% of the abortion care that Planned Parenthood provides is medication abortion. So when we talk about the distinction, when you are losing hundreds of dollars every time you see a patient, that really dramatically impacts your ability to deliver care and increase access to that care. So we are excited to see that the executive budget proposes an increased reimbursement for reproductive health care services in Medicaid. We're still working to understand operationally what that increase looks like. It's important to us that that increase is for all abortion care, that it's also for other reproductive and sexual health care services to really shore up the safety net at this time. And so we're going to be continuing to advocate for that throughout the budget process, in addition to supporting the $25 million in grant funding that was proposed in the executive budget for abortion access. So I think that's a little bit of where we are right now on that on the funding pieces, that from our perspective.
Which Georgiana and Quadira for talking about the budget issues around reproductive health right now. So I rushed everyone. So we have a few minutes for our speakers. If you want to add any points, or if people have questions, either put them in the chat. There you go. We can take those. And folks will stay on for a few minutes after the call as well, if you feel like that's a better way to ask your question. First, with our speakers, is there anything you wanted to add? I mean, I think there's a lot of the budget is huge, right? And so everyone, so many people across the state who care about these issues and other issues are also, pushing for their agenda, right? And so this is part of the process for us to really make our voices heard, to mobilize around this. And we have had success in that in the past. So, it feels like all the things you've said, speakers, make sense to me, but that's not how the system works, unfortunately. So, I think how we push forward, maybe you could share that, or Blue, you are in the middle of, if you want to just share what you're doing right now.
Well, we're in the middle of a week of advocacy right now. So we kicked off with a 300 people on a virtual rally on Tuesday. I can't even know what day it is. All right, 2 days ago. This afternoon at 1 o'clock, we have a Child Care Advocacy 101 show, which is for all our people who are planning to attend legislative visits to help them prepare and understand the ask. We have another one of those on Saturday at 10:30 in the morning. And then next Tuesday, February 14th is our live advocacy day in Albany, where we have a lot of legislative visits and a rally and a press conference scheduled for noon on the $1 Million Staircase. So, we welcome anybody who wants to at this point come to the rally. I think we're full up and with everything we can handle in terms of buses coming in and meal vouchers and things like that. But, if you're in or around Albany and would like to come to the rally, you're welcome.
What time is the rally? And that's on the
noon.
Noon. And will there be a social media, effort at the same time?
There will be a social media effort at the same time. Yeah.
Okay. What's the hashtag that you're using? Just so
it is hashtag
and ask that.
NY Universal Childcare.
That's easy. That's just what we want. Okay, terrific. So turning to Ilana and Bobby, do you want to just reiterate anything?
Yeah, and let me jump in unless Ilana wants to, because I know she's not feeling it. So this past, and Ilana, feel free if you want to add. Sorry. This past Monday, we had a lobby day in person in Albany. We had it was mainly sponsored by the Consumer Directed Personal Assistance Association. So we had people with disabilities, literally from Brooklyn to Buffalo, show up. And we had 150 home care workers from 1199 join us, and members of the New York Caring Majority. We, did a rally and speakers in the well. We went up to the 4th floor Senate, whatever that one, I don't think that's the $1 Million Staircase, but it's this other area. And we did a press conference, which I co-led with a home care worker. We had a lot of legislators show up. There's a new chair of the Health Committee, Amy Paulin, and so she seems to be, very supportive of our work. And Rachel May, Senator Rachel May, will continue to be the primary sponsor. We're doing a grassroots effort. We have a letter writing campaign statewide to Governor Hochul, coming out of anybody who will send a letter, but a lot of it coming out of older adult centers across the state. We have the letters in English, Spanish, and Chinese. And we have district leaders that are setting up, mostly on Zoom, are setting up appointments with legislators and their staff at this time to get them on board the bill, and of course, push them to include us in their budget letter. So I don't know, Ilana, if there's anything that I missed that you would want to add. And obviously a lot of conversations going on with various legislators at this point. They're very, one more quick thing, what we pick up is they're very upset about what Hochul has done to home care, because she just broke this promise like right away.
So let me turn to Quadira and Georgiana. Is there anything that you want to share in terms of actions? Because, we're learning these things, but really what we want to do is inspire people to to take action yourself, and also to bring it to your organizations or your network of friends. There's nothing like a local person calling your assembly member, your senator, or a worker actually doing that as well, really to be heard, and to be listened to. So Georgiana or Quadira, are there any plans that you want to share before we close?
Well, we don't have any, well, Gigi doesn't have any external moments happening like these other wonderful advocates. So the only thing we are asking is to submit memos of support for the reproductive.
Okay. Quadira, is there a sample memo of support?
Yes,
yet?
we have a memo of support. We do want to clean it up a bit. And then I'm going to follow up with an email with the memo of support so folks can reference the language.
That's great. So we'll share that whenever you have it. So, and Georgiana, what about you?
So we actually already had our large lobby day in January. But I think as we learn more again about the specifics of the rate increase in Medicaid, we may have additional asks. I second the memos of support are helpful, and as we kind of go through this dynamic time, I think we'll continue to push out through social media and our other mechanisms, and can use PowHer Bev's listserv if there's other direct asks that come in the future based on kind of the moment that we're in.
Terrific, great. Well, that's all, a lot of information, but there's also a lot of things that we can do, which is very empowering, I always feel, and one thing that we didn't start out with the fact that we're not having to lobby this year or push this year for, we already did for the New York State Equal Rights Amendment. So of course that is, that's something that's been passed already, and we'll all start working on to make that go to the public and have a positive outcome. So there are plenty of other issues that we're going to be talking about. In a couple of weeks, we'll have another briefing on some of the economic issues, other economic issues that PowHer is particularly involved in, one fair wage, minimum wage, and also continuing equal pay. For those of you who aren't here every other week, we are Equal Pay Day will be March 14th, so look for information about that. And thank you for joining. If you want to stay on for a few minutes while people pop off and ask any questions of our speakers, then please feel free to do that. But otherwise, look for an email from us that has a collection of a lot of information and activities, and you'll be able to take that to your community. So thank you very much for joining this morning. Really appreciate having you involved and acting, and together we've made a difference, and we can definitely make a difference with these issues too. Thank you.